I look at these reports from the Rural Hospital Association and so forth. Look, it's not just hospitals, it's ambulance services going bankrupt. And what I continue to hear, one of the big problems, and I know you know about this, is that the reimbursement rates from Medicare and Medicaid and other government sources continues to go down, 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 down every year. And the difficulty to get it back gets increased every year. We've gone from reimbursements being fairly straightforward, you'd get them in 3-4 weeks, to as long as a year or more. And hospitals have been forced to create entire departments to try to chase down ever smaller amounts of money from the government. It's a losing cycle, isn't it?
It is. There's a situation that we have now where commercial payers, employer plans, are basically subsidizing the government programs, not just in paying enough to cover the cost of services, but timeliness of payment, like you mentioned as well. So you have these hospitals that rely largely on government payers, Medicare, Medicaid, and uninsured patients that are waiting 6 to 12 months to get compensated for care. And when they get compensated, it's not enough to cover the cost of care.
Yeah, I was telling folks yesterday, I was in a place called Duckville, Tennessee, small place in the Copper Basin. And the amount of money being paid to a hospital there that went out of business in 2018 for an emergency room visit was $15. $15 was all they were being compensated for. And by law, the hospital is required to treat these people. The ambulance service required to go to their house if they call 911. $15, that doesn't pay for anything, does it?
No. And so you see nonprofit hospitals that end up moving to richer areas where they'll have more commercial payers if they're urban. So that way they can survive. They get vilified for doing it, but they simply wouldn't be able to survive without doing so. But when you're in an urban area, you don't have that option. You can't just move your facility or add another facility in an area with more commercial payers. You have the payer mix that you have, and it tends to be older, it tends to be sicker. Things like heart disease, 31% higher rates of heart disease in these rural areas. And yet you have facilities that now about 50% don't have access to acute care in these areas for more than an hour. We have tens of millions of Americans who cannot get access to acute care without going more than an hour. That's a long way to go if you're having a heart attack.